All right. So this week we are going to start what I believe is the last section, and we're going to talk about human physiology and some of the aeromedical concerns when we're talking about flying in general. So I don't know. I mean, personally, I find that this stuff is interesting, but I don't, have any real medical training, and I'm not really a doctor or anything. So of course, most of this is just kind of what people have come up with the studies and stuff. Um, and most of what we're going to talk about is highly dependent on person to person, with the exception of a few things. And so, some of the symptoms of some of the stuff we're going to talk about, some of the illusions we're going to talk about, they all vary from person to person. So it's highly individualized. And the moral of the story is that you should know how your body reacts given a certain situation in order to avoid potential hazards. Um, so without further ado, we'll get started here. So the first thing I'm going to talk about is the medical certificate. And the medical certificate is one of the three items that you need in order to fly. So you need a medical certificate, you need your driver's license or some sort of photo identification, and then you need your pilot's license. And those are the three things you need to fly. Now, if you're a student pilot, there is some extra stuff you need, but we're going to stick to private pilots and above for now. So you need a medical certificate in order to obtain your pilot's license. So a medical certificate is a prerequisite. Now, there are some exceptions to this rule. Those exceptions include if you're flying a glider, if you're flying a free balloon, or if you're a sport pilot. So if you're in one of those categories, and I think there's a few other things, then you don't need to get a medical certificate and you can just get the pilot's license. Um, so, but I'm assuming that, since we've been talking about mostly private pilot stuff, that if you're going to go for your private pilot, you're going to need a medical certificate. So we're going to focus on that for now. So how do you obtain a medical certificate? Well, you have to go find what's called an aviation medical examiner. And this is a person who the FAA has designated to basically do a very specialized type of physical to determine whether or not you are capable or able to fly. And if you go to the FAA's website or if you search FAA AME lookup, they actually have a way to search by city, and you can find an AME that's close to you. I think up here in Houghton, the closest one is at the STC Health Clinic. I think there's a doctor there who is an AME. And so you would just call him up and say that you would like to see him for a medical and an aviation medical. And then he would be able to do that for you. Um, so when we're talking about medicals, there are going to be three different types that you're looking at. So the first type is a third class. Now, this is technically the lowest class of medical. However, there is something below it, and that's called basic med. And basic med is used for pilots that have had a medical, first, second, or third class medical at some point in their life. And actually, I don't think it's in their entire life. It's like in the past 6 years or something. I can't remember the exact number, but sometime in the recent past. And basically, basic med allows them to go see a regular doctor who's not an AME, and they can sign off and they can have this basic med, which just allows them to basically fly as a private pilot in a small aircraft with, not a lot of passengers or anything. And the basic med requirements are quite relaxed from what you would be required to have for a third class, second, or first class medical. So anyway, that's basic med. I'm not really going to focus on that because for the most part, no one who's like under the age of 40 should really be worried about that too much. But it is an option. So a third class medical is used when you want to just fly as a private or recreational pilot. So this is the lowest class of medical. It has the most relaxed type of restrictions, and it has the most relaxed type of, or not restrictions, requirements. And it doesn't take a ton to get a third class medical, but there are some things which I'll talk about in a little bit that may disqualify you or make it harder to get. A second class medical is needed for commercial operations. So if you intend to fly for money, you will need a second class medical. There are some ways to get around this need of a second class medical for certain types of commercial operations. It's just kind of playing a legal game at that point, but if you're flying for money, chances are you need a second class medical. And just like third class, it basically encompasses everything the third class does, and it has a little bit higher standards. And then finally, the first class medical. This is like the highest class of medical that a pilot can obtain, and this is needed for airline transport pilots. So if you're flying people in larger aircraft, then this is what you'll need to get. And medical certificates expire. Obviously, you'll need to go back and get rechecked every so often. And depending on what class of medical you have and what you're using it for, depends on when it expires. So let's say that you have a first class medical certificate, or you obtain a first class medical certificate at the age of 39. So why 39? Well, at the age of 40, the FAA changes the numbers usually. And we'll look at that in this chart here below in a second. So let's say you obtain a first class medical certificate at age 39. And all you want to do is fly as a private pilot. Well, how long can you exercise the privilege of private pilot? And the answer is 5 years. So let's try and figure out how this math works. So if we look at this chart, we see that it's divided into kind of two categories. So we have under 40 and 40 and over. Now, under 40, these are going to be your longest times that you need to go without a medical. So, or longest time between checkups. So for a third class medical, which you need as a private pilot as a basic minimum, it's good for 5 years under 40. So in this example, our pilot is age 39 when he gets his medical. So he would be under 40 category. And so that medical he obtains would be good for 5 years. And now the kind of caveat here is that he obtained a first class medical. And the way this works is no matter what medical you get, if you are exercising it as a private pilot or a commercial pilot or whatever, then the validity rules kind of translate down, if you want to think of it that way. So a first class medical isn't really good for 5 years if you're using it for ATP purposes, but it is good for 5 years if you're using it as a private pilot. So anyway, I'm going to go over this chart in a little more detail. Hopefully I'll make it clear. So third class medical, good for 5 years under 40. And these are private pilots. If you're over 40, then the third class medical is only good for 2 years. A second class medical, which can be used as a private pilot, is good for 5 years, just like the third class medical under 40. And then over 40, it's good for 2 years. If you're using your second class medical for commercial operations to make money, then over 40, it's good for 1 year, and under 40, it's good for 1 year. So there is no distinction there in age. And then a first class medical, if you're using it just for private pilot purposes, is good as the same as a third class medical, 5 years and 2 years. And then a first class medical as a commercial is only good for a year. And if you're going to use your first class medical as an ATP pilot, then it's good for 1 year under 40 and only 6 months if you're 40 and over. So it's not a ton of time. And you can find all of these laid out in FAR 6123. So like I was talking about earlier, there might be some things that show as a concern to an AME. And these are just things to keep in mind. They don't necessarily mean that you won't be able to get a medical. You can often get a medical even if you have one of these conditions, but the FAA does look at these a little bit closer than someone who doesn't have these. So you can still get a medical even if you have impaired vision, impaired hearing, or some sort of physical limitation, whether that be a loss of limb or something else. But there are also some conditions which may hinder your ability to get medical. So diabetes, heart disease, any type of heart problem, heart replacement, if you have any type of personality disorders, psychosis, bipolar disorder, or a history of substance abuse or substance dependence, or even epilepsy. So this is a short list. There are, of course, some other things that the FAA looks at when you have to fill out a form before you go see an AME. And in the form, they basically ask you to list every single condition you've ever had in your entire life. And if something shows up, like for me, when I went to get my medical, I wrote down that I used to have asthma as a kid. I don't anymore, but I used to, and that uh, flagged for them, and they made me, prove that I didn't have asthma anymore. So it's things like that, and if you can prove that you have it in a maintainable condition, then the FAA usually is fine with that. So I don't think of these as disqualifying conditions, but more of it'll just require a little bit more paperwork. So aside from the medical, we're going to now transition and we're going to talk about some physiological factors in regards to aviation. So there are a lot of things to keep in mind when we're talking about this physiological stuff. One thing is that, we're just human and humans have limitations. So, we obviously get tired. So fatigue is an issue. We have to breathe oxygen. So if we have limited oxygen supply, that becomes an issue. And there are, certain balances within our body that we have to maintain. Otherwise, we can get disoriented. We can start having uh, effects on our body that we don't know how to deal with. And weird things can happen. And the flight environment, which is different than a lot of other types of environments because we're operating in 3 dimensions instead of just 2, can really enhance some of these, especially when you start getting into higher altitudes or having some of the other problems. So some of the things we're going to talk about include hypoxia, hyperventilation. We're going to talk about ear and sinus problems. We'll talk a little bit about motion sickness, CO poisoning a little bit. We'll talk about fatigue and stress, heat stroke, dehydration, effects of alcohol and drugs on the body. And we'll also hit on the excess nitrogen in the blood from scuba diving. So the first thing we're going to talk about is hypoxia. And really when we're talking about hypoxia, we're talking about limitation of oxygen to the body in some form. And we're going to specifically talk about 4 different types of hypoxia. There is hypoxic hypoxia, which is just kind of a broad general term, which just means that there's insufficient oxygen to the body as a whole, whatever that might mean. Hypemic hypoxia is when the blood is not able to take up and transport oxygen. And we'll talk about each of these in detail coming up here. Stagnant hypoxia is when you have oxygen-rich blood in the lungs, but it cannot get to where it needs to go for some reason or another. And then finally, we'll talk about histotoxic hypoxia, which just means that the cells cannot process the oxygen given to them. So some of the symptoms of hypoxia, and again, this is one of the things that varies from person to person, but in general, these kind of encompass all the possible symptoms. So if you start having, your fingers turn blue or your lips turn blue from a lack of oxygen, cyanosis. If you start to get a headache out of nowhere, decreased response to stimuli, impaired judgment, euphoria, visual impairment, drowsiness, lightheaded or dizzy sensation, tingling in the fingers and toes, and of course numbness. So all these things kind of encompass some form of hypoxia. So any of these could cause these. Some of them are more likely to cause some than others. So like stagnant hypoxia could cause tingling in the fingers and toes because you cut off circulation to them or something. Same thing with numbness. Other types could cause more types of brain type impairments where you have impaired judgment, euphoria, some sort of visual impairment or drowsiness, that kind of stuff. So these symptoms, are quite varied and quite large in scope, but kind of as a baseline, unless you actually experience hypoxia, you won't know how your body reacts. So the first one we're going to talk about is the hypoxic hypoxia. And this type of hypoxia is, again, characterized by the insufficient oxygen availability to the body as a whole. So normally this is caused by like a blocked airway, or when you're drowning, you can't get oxygen to your body, and so you can't process that oxygen and send it out to where it needs to go. However, when we're talking specifically about flying, this could be caused by a reduction in the partial pressure at high altitude. So as you climb and the aircraft's altitude changes, the percentage of oxygen will stay the same, but the actual amount of oxygen decreases. So you can't get the same amount of oxygen you had on the ground, and you'll need to supplement that at some point. Usually we start to supplement above 10,000 feet or above 4,000 or 5,000 feet at night. So one other cause, which I don't know how you would encounter this, but if you are for some reason transporting dry ice, that dry ice could start to vaporize, especially if it's in a sealed aircraft. If it's in an unsealed aircraft, then this isn't as big of an issue, but that dry ice could start sending its vapors into the airplane, which then could get into your body, and then it'll limit the amount of oxygen that you can breathe in, or what little oxygen there would be left to breathe in. But again, I'm not exactly sure when you'd be transporting dry ice. Next, we're going to talk about hypemic hypoxia. And this is again where the oxygen, where the blood is not able to take up and transport a sufficient amount of oxygen. So for some reason, your blood is not taking the oxygen where the blood is not taking up the oxygen, and it therefore cannot transport the oxygen to where it needs to go. So usually this results from an oxygen deficiency because there's not enough oxygen in the body to go to the blood to be transported. However, this also could be caused by reduced blood volume. So for instance, let's say you go and you give blood, and then you would decide to fly the next day or that same day even. One, that's not a good idea, and there are FAA guidelines on when you should wait after you give blood and before you go flying. But this could also be caused by certain blood diseases such as anemia. And so when you have less blood, obviously you have less oxygen carrying capacity, and you could end up with this hypemic hypoxia. However, one of the most common causes of hypemic hypoxia when we're talking about aviation in specific terms, we're talking about like CO poisoning. And so if you have carbon monoxide in the aircraft and you start breathing it in, you probably won't notice it, and then all of a sudden your body has no oxygen and you just shut down. So most airplanes have some sort of CO detector so that they can detect when you're having elevated CO levels, and then you can take precautionary measures or figure out a way to get oxygen to your body. Stagnant hypoxia is, again, when blood is just not flowing to where it needs to go. So you have oxygenated blood in the lungs, but for some reason that blood is not making it to the tissues that need it. So let's say if your arm or leg went to sleep, so you sat and you had your legs crossed for an hour or something, eventually the blood start to get constricted and your leg falls asleep. This is an example of stagnant hypoxia. Now, of course, this could be caused by other things other than just having your arms or legs crossed. This could be caused by heart failure, shock, or a constricted artery. And these could also cause the blood to be constricted and not able to flow to where it needs to go. When we're specifically talking about flight, sometimes pulling excessive G's could cause stagnant hypoxia as well. However, I doubt that we will be pulling sufficient G's to cause stagnant hypoxia in a Cessna. Histotoxic hypoxia is, again, the inability of cells to use oxygen provided. Usually this is a result of some sort of alcohol or drugs, and they're causing the cells to not take up the oxygen that's given to them. This kind of breaks into two words, the histo meaning cell and toxic meaning poisonous. So for some reason your cells have been poisoned by alcohol or drugs and they cannot use the oxygen efficiently. So just one tip would be to wait 8 to 10 hours after consuming alcohol before going flying again. So the mnemonic goes 8 to 10 hours, bottle the throttle. So how can we avoid hypoxia? Obviously, this is a bad thing, and we really do not want to experience it. But one thing we could do is we could fly to lower altitude. So if you start to notice you're getting hypoxic symptoms, then you can either descend, or if you're flying on a flight plan, then you can ask ATC to descend, and then hopefully you can restore those oxygen levels. Another thing you can do is if you have oxygen on board, then you can use that supplemental oxygen, and you can either, if you have a mask, respirator, or some other way to get oxygen in you, then you can put that on, and you can start to increase your oxygen levels. Like I was saying earlier, usually above 10,000 feet is where we start to use supplemental oxygen, and above that is where we really start to see this severe increase in symptoms from hypoxia. Also above 10,000 feet, the time of useful consciousness starts to rapidly decrease. And this is the time that you have before you can no longer process anything, and your brain just shuts down and it becomes unconscious. So if you were curious what your reaction to hypoxia would be, or if you wanted to see what happens when you become hypoxic, they do have places you can go and you can experience this. So they have what are called altitude chambers, and basically they put you in this chamber and they give you an oxygen mask, and you sit there, and then they give you some stuff to do. I don't know whether it's adding numbers together or solving puzzles or whatever it is. And then they'll ask you to take your mask off. And in this room, it's adjusted to some altitude, a high altitude, and you become hypoxic, and you start to see how your body reacts and how it becomes slower and how it develops some of these symptoms that we were talking about earlier. And so it's a good way to get experience with this without necessarily any of the risk. All right, so now that we covered hypoxia, we're going to switch over and we're going to talk about some of the other things that were on that list in the first slide. So hyperventilation. Hyperventilation is the excessive rate and depth, or it's having the excessive rate and depth of respiration, which leads to an abnormal loss of carbon dioxide from the blood. So when you start to breathe really fast and you're breathing really deep, then you're flushing out this carbon dioxide from the blood, and this could be serious. Now, usually it's not, but as long as it's controlled. So if you start to get out of control with hyperventilation, this can obviously cause unconsciousness or other problems. So one way that this could kind of become a problem is if you're in some sort of stressful situation and you're at a high altitude and you start to breathe more heavily and rapidly because there's not as much oxygen there, and so you start to panic and you start to become more aware that you're hyperventilating, but it's a stressful situation that you're in, and you just start to have this negative feedback loop. And eventually you end up in this severe hyperventilation state. And some of the symptoms you might experience might include visual impairment, unconsciousness, lightheaded or dizzy sensation, tingling sensations, hot and cold sensations, or even muscle spasms. And these are very similar to the hypoxia conditions or hypoxia symptoms, with the exception of a few, the muscle spasm and the hot and cold sensations. And so it's important to be able to distinguish between hyperventilation and hypoxia. Hyperventilation can be solved by simply calm down, and sometimes they say you're supposed to breathe into like a paper bag, to preserve that carbon dioxide. And then eventually, once you calm back down, then the symptoms will disappear, and then you should be fine. So middle ear and sinus problems are a big thing when we're talking about flying, because a lot of the illusions and a lot of the problems that we're going to talk about, through the rest of this section involve the middle ear and sinus, or really more the middle ear, but the sinus is included here because we're going to be talking about gas blockages. So these are important parts to flying. Having that middle ear to tell you, your orientation, and having that ability to discern, where you're at. Now, sometimes it could be your detriment, but for the most part, we'll assume that it's functioning as it's intended. But specifically, right now, we're going to talk about what happens when we have gas that gets trapped in the middle ear and sinus. So during climbs and descents, gas can get stuck in certain body cavities, and if it has no way to get out and equalize with the air around it, then this gas may expand or contract, depending on what you're doing. And if you have this trapped gas, it can cause, ear pain. It can cause if it's in your sinuses, it'll cause, headaches and stuff, or even rupturing your sinuses, which is not good. And so pressure release needs to happen, and it needs to equalize the pressure difference between the inside and the outside. Now, sometimes the ears need a little bit of help in order to relieve pressure. And if you've ever driven up like Quincy Hill or something, I'm sure you've experienced this, or if you've flown in an airplane up to higher altitude, then you've experienced this, where you need to relieve the pressure in your inner ear. And to do this, you can kind of, some people say you can like chew gum, or you can, pop ears or whatever. But the actual maneuver, which is called the Valsalva maneuver, is where you pinch your nose and you close your mouth and you blow. And this should allow your ears to pop. Basically just opens up the passageway and allows the pressure to equalize. And then once it's equalized, the pain goes away and you can continue flying. Sinuses, on the other hand, we don't really have the ability to open them up easily. They're just kind of naturally open. But sometimes they can get blocked during, if you have a cold or something, they can get blocked and they can have this trapped gas in there. Like I said, there's really not an easy way to clear the sinuses. There's no muscles or anything there to help equalize this pressure. They're just kind of naturally open. So when they get blocked, this is a really big problem. And this is one of the reasons that you should definitely not fly if you have some sort of upper respiratory infection or a sinus block or a cold or anything. Because having your sinuses blocked like that can cause serious problems. If you go up to altitude, then you come back down and your sinuses are blocked, you could rupture your sinuses, and that's not a good day for anyone. Usually though, if you have the sinus blockage and it doesn't rupture during descent, it will hopefully clear shortly after landing. All right, next we're going to be talking through a long list of illusions and disorientations that you can experience when you're flying. So there are really two types of illusions we're going to talk about, and these are correlated to the two different systems that we're going to focus on. So we have the vestibular illusions, which are based around the organs found in the inner ear, and these relate to how you sense position and balance. And we're also going to talk about visual illusions, and these are based on what your eye sees and how it senses its own position. And usually, the difference between the vestibular and the visual systems are what can cause problems like motion sickness or disorientation and stuff like that when things don't start aligning up and your brain is trying to figure out what's going on. There's also a third system which the brain uses to augment the other two that we just talked about, and that is the somatosensory system. And this system includes like the nervous system, the skin, the muscles, the joints, anything that you could use to sense gravity. Sometimes even the auditory system is included in this system. And so these are things like when you're sitting in a seat, you know that you're sitting in a seat, and you kind of feel the way that the pressure is around your body by using this system. And so it helps to augment your position and your balance. So first, we're going to talk about all of the different types of vestibular illusions. And again, these are all the types of illusions that relate to the inner ear. So first, the leans. What is the leans? Well, if you are in a gentle, gradual turn, and then all of a sudden you decide to return to level flight, then your body may instinctively lean in the direction of the original turn. And this is caused by the body not being able to detect that you were in a turn at all. So if you're experiencing anything below a rotational acceleration of 2 degrees per second, your body does not realize that it's doing anything, and it just kind of thinks that you're sitting still. And so if you're in this gentle, long turn, you may not notice it. And when you return to level flight, you'll actually think that you're banking, and so you'll try and counteract that, even though that's not what's happening. The Coriolis illusion, this also happens when you're in a turn. However, it might be a steeper turn or whatever. It doesn't really matter in this case. When you're in a turn for extended periods of time, the fluid in the ear may start to catch up with the ear canal, and everything might start to equalize. And when this happens, any movement that occurs with your head, so think of like starting to look at something in the aircraft that's, let's say you're looking out the window and then all of a sudden you decide to look down to the right at the rudder pedals. That sudden movement could cause your brain to think that the aircraft is all of a sudden moving around you instead of you actually moving. And so you might try to correct for this in whatever way that you think is best. And this usually just makes the situation worse, and you end up disoriented. The graveyard spiral. Again, we're going to be talking about this kind of prolonged, coordinated, constant rate turn. And eventually you might get to the point where, you don't think you're turning at all. And this is especially dangerous because when you try to return to level flight, you may actually try and correct back to where you think is level flight, which is actually banking into the turn. And so you're going along and you're in a turn, and all of a sudden you return it to level flight because that's what you wanted to do, but it doesn't quite feel right. And so you bank it back into the turn, which feels like level flight, but it's not. And all of a sudden you start losing altitude because you're in a bank and you're not correcting for it. And so you pull back on the controls and you tighten that spiral, and eventually you'll probably lose control and maybe even crash, which is why it's called the graveyard spiral. The somatographic illusions. These occur when you have some sort of rapid acceleration. So usually when we're talking about rapid acceleration, we're either talking about takeoff or if you pull the throttle back while you're flying and all of a sudden you slow down really fast. What this does is it actually stimulates certain organs in your body that make you believe that you're actually like pulling the nose up or pushing the nose down, depending on which way the acceleration goes. And so if we take the case where you're flying along, then all of a sudden you pull the throttle really quick and you think you're decelerating, then you're going to believe that you're all of a sudden starting to pitch down, when in reality you're remaining level. And this will cause you to try and pull back on the yoke, believing that you're trying to pull out of a dive, and this could cause you to stall. The inversion illusion. So if you're changing flight attitudes relatively quickly, you can start to get this illusion that you're starting to tumble backwards. So if you're flying straight and level, you climb for a little bit, and then you return to straight and level flight very quickly, then it might start to feel like you're in this tumbling motion, and you might start to correct that by trying to push the nose down, which may actually worsen the situation by intensifying the illusion, and you see this negative feedback loop again. So none of these are good. The elevator illusion, this is the last vestibular illusion, and this is caused by some sort of abrupt upward vertical acceleration, or deceleration. So an updraft or a downdraft would be a good example of that. And this will cause you to think that you are in some sort of climb. And so, your reaction to that would obviously be to push the nose down or pull the nose up, depending on what's happening. And that's not what you're supposed to do. So any type of acceleration from normal flight is bad. It's going to make you think that you're doing something that you're really not. And you just need to be aware that these exist and that you need to trust your instruments and what they're telling you, and that they're right, and your body's wrong. And that's hard to do sometimes. All right, visual illusions. There are only two visual illusions that we're going to talk about now. There's actually a whole another half of this section which focuses just on visual illusions, but we're going to save that for probably next time. So first, we're going to talk about this false horizon. So imagine that you have a line of sloping clouds, or you can't see the horizon because of fog, or it's dark outside, and all you see are lights and stars, and they all look the same, and you can't discern where the horizon is. This is what's called a false horizon. You just kind of make up where the horizon is because you don't know where the horizon is. Or maybe there's something that looks like the horizon, but it's actually not the horizon. And this can be very dangerous because you'll try and align your aircraft with this horizon naturally because that's what you want to do. But this isn't what you're supposed to do. It actually could cause your aircraft to go into a higher angle than you need to, or it could be causing you to point down towards the ground and die very quickly. And so this false horizon, again, can be avoided by looking at your attitude indicator and realizing that you're not pointed towards the thing that you think is the horizon. Autokinesis is what happens if you look out at night and you stare at a light, and then all of a sudden this light, which is stationary just before, starts to move. And you, thinking that the light is stationary, think, well, I must be moving, when in reality you are not. Everything is still stationary as before, but you think the light is moving, and so you try and correct to the moving light, however that may be, and you have this loss of control. All right, now we're going to talk about some of the optical illusions that you may experience during flight. So these include a lot of different things. Usually it has to do with how far away something is versus how you perceive the thing to be. Like in the case of runways, you perceive the runways to be a certain size, but in reality, runways are often many different sizes and many different widths. And so these are just ways that your brain plays tricks on you and tries to process things quicker. So runway width illusions, a narrower than average runway, or narrower than what you're used to, can often create the illusion that you are higher than you actually are. Conversely, when you have a wider than normal runway, then you think that the aircraft is lower. And this kind of makes sense if you think about it. If you're flying and you have this really small runway, from a distance, if it was a normal size runway, then you would be really high. But the reality is that the runway is actually very narrow. And so you aren't high. It's just the runway that is narrower than normal. And so this is where it pays to do your research on what, the airport has available to you before you land there as far as runways. Similarly, an upsloping runway or upsloping terrain can cause the illusion that the aircraft is higher than it actually is, or if it's downsloping, then it can give you the illusion of being too low. And, just like the narrow runway, wide runway problem, this can also be a problem if you're, landing in the mountains or something. You think you're higher than you actually are, but you're not. And, you land short. That's a big problem. A featureless terrain illusion. So this usually happens when we're approaching land or approaching a runway, and we're over the water or over just nothing. You're out in the middle of nowhere and there's nothing. It's just completely flat. There's no houses, no trees, no cities, no nothing. And when you have nothing to base your position on outside, or no horizon, or nothing to base your reality off of, you can oftentimes believe that you are higher above the ground than you actually are. And again, this is a problem because you are not actually higher off the ground, you are lower. And this can lead to airplanes crashing short of the runway, or crashing into things like mountains or hills or something like that. And so sometimes this is also called a black hole approach if you're flying into an airport. So water refraction, specifically when we're talking about like rain on a windshield, the water on the windshield. Now, if you're in a Cessna, there's not a ton of water that gets on the windshield from rain because the propeller's out there spinning and it's driving all the water off of your windshield. However, in like twins or jets, you'll have windshield wipers. And so the rain can build up over time and it can cause this refraction, and it can cause you to believe that you are at a higher altitude than you actually are. So again, trusting your instruments, believing that they're right, will save you from these illusions. If you enter haze, or you have haze on the horizon, it can, make you believe that you are higher or farther away from the runway than you actually are. Conversely, if you have clear air, really clear air, like crystal clear air, then you can start to believe that you were closer to the runway than you actually are. And this just has to do with how you perceive distance and how you perceive, things fade. I mean, normally it's a nice day, but it's never perfectly clear. And so you perceive that there is going to be some degradation in that light as distance goes on. And so referencing that against something like extreme haze or extreme clear air will cause these illusions. Fog, if you're flying into fog, usually it will give you the sensation of pitching up. Now, if you're flying into fog and you're not IFR rated, that's a big problem. So if you're flying in fog, you should be flying on your instruments. You should be trusting them anyway. Not to say that you won't get the sensation, but usually you won't be looking outside to even realize that. You'll be looking at your instruments and you'll be flying those. But if you're VFR and you're flying to fog, then that's a big problem, and this definitely is a thing. And flying into fog is very dangerous as a VFR pilot, obviously. So some ground lighting illusions. So if you're flying at night and you have this really long string of lights along a road or a highway, it's easy to mistake those for landing lights at a runway. I mean, you're looking for a runway, and runways have straight lights, and the roads have straight lights, and so it's very easy to mistake an airport for a road at night. Also, having really bright runway lights can create the illusion of having less distance to the runway. Again, this has to do with how your brain sets the kind of baseline of what a runway should look like, and then having anything abnormal from that, it just kind of like, oh, well, runway lights aren't brighter, it's just that you're farther away or you're closer or whatever that illusion may be. So the last thing I want to talk about today is what's known as decompression sickness. And if you've ever been around scuba diving, you've probably heard of this. Oftentimes we talk about the bends in scuba diving, and that has to do with decompression sickness. It is a symptom of decompression sickness. But what is decompression sickness? Or I'm going to call it DCS for now. So DCS is a condition where you during exposure to low pressure, so i.e. flying really high, the inert gases, mainly nitrogen, will come out of solution in your body and it'll form bubbles. So that's not necessarily a bad thing in of itself. That's natural and that's good. However, if you try and force that nitrogen back into solution by descending really quickly, that's not good, because the nitrogen will try to rapidly form bubbles and try and get out in any way it can. And so we want to avoid this if at all possible. Now, this isn't terribly common. You have to be flying pretty high in a very unpressurized aircraft. But, this is something to be aware of. So usually when you encounter this decompression sickness from flying at a high altitude and descending really quickly, you're going to experience it in the form of the bends, which is really just joint pain from the buildup of nitrogen. Now, what should you do if you start to experience the bends or some other symptoms, which I will talk about here in the next slide? Well, the first thing you should do is you should put on an oxygen mask and you should switch it to 100% oxygen. This will help give your body, that extra oxygen it needs, and it'll help the situation. So you should then start to descend. There's a special maneuver called an emergency descent where your basic goal is to get on the ground as fast as possible. So whether you actually perform an emergency descent maneuver or you just get to the nearest airport as quickly as possible, whatever that means, you should get on the ground. Because oftentimes when you have DCS, you need to get into a hyperbaric chamber to reset your body to that higher altitude and then slowly bring it back down. If joint pain is one of the symptoms, if the bends is one of these symptoms, then you should try and keep that affected area still, and you should not try and work out the pain. That'll just make things worse. You should try, just to relax and as much as possible. You should, once you land, seek medical attention. You should continue to breathe oxygen, and the medical attention that you seek the person who you receive the attention from should be familiar with aviation or hypobaric medicine. Otherwise, they may not know exactly what to do. So usually this will involve putting you in a hyperbaric chamber and then lowering your altitude gradually. And some things to note: sometimes these symptoms may be delayed. So you might land and then, 30 minutes, an hour later, you might start to experience these DCS symptoms. And so you should just be aware that there could be a delay in the onset. So here's a full list of symptoms. I'm not going to go through it, but they can affect many parts of your body in many different ways. So they can affect your joints, the bends, that's the most common. But they could also affect your brain, your spinal cord, your nervous system, your lungs, and your skin. And so none of these things are good. And if you experience any of these symptoms, you should definitely land and get it checked out. So this is kind of a niche subject, but it's important. So if you think you should go flying after you've been scuba diving, the answer is no, you shouldn't, for many reasons. One is that as you go and you scuba dive down to some depth, whatever that might be, your body's going to be put under more and more pressure, which will put more nitrogen into your body. And as you try and climb back to the surface and you return back to normal pressure, that nitrogen has to go somewhere. And so it tries to exit your body. This, will result in the symptoms like we just talked about. Now, that's just when we're talking about scuba diving. Now, if you're going to go flying, and you're going to go to even higher altitudes and even higher or even lower pressures, this could really exacerbate these symptoms. And so you should wait, allow your body to process that nitrogen and get rid of it before you go flying. So the recommended times, it's kind of divided into an altitude. So you have 8,000 feet as a bar. If you went on a scuba dive and you did not require a controlled ascent, so you didn't need to stop on the way up, then you only need to wait 12 hours after that scuba dive to go to altitudes lower than 8,000 feet. If your dive did require a controlled ascent, i.e. you did require stops on the way up, then you should wait 24 hours before you're flying to altitude less than 8,000 feet. And if your flight is above 8,000 feet, then you should just wait 24 hours to allow that nitrogen to leave your body.